From Moscow to Milan and Singapore to Seoul, the watchword these last weeks and months has been lockdown. Now, many of these places are beginning to loosen COVID-19 restrictions. But as Nick Schifrin reports, in this global pandemic, the first steps are made cautiously and with no guarantee that there won't be steps back.
After 7 weeks of Spanish quarantine, the beach bums are back. Spain's small businesses also reopened, and following one of the world's strictest lockdowns, a café con leche tastes like heaven.
It tastes so good. It tastes like the glory of my life.
For the first time in almost 2 months, Parisians left the house without government permission. Shoppers filled the Champs-Élysées with their boutiques of choice written on mandatory masks.
Wearing pajamas all day long doesn't help. I want to go shopping again. It's good for our morale.
In Switzerland, beef is back on the menu as diners are allowed to return to restaurants. Elementary school students are back in the Netherlands, sitting behind plastic shields. And in Russia, despite a new surge of cases, President Vladimir Putin is also looking to reopen.
Starting from May 12th, wherever possible, it is necessary to create conditions for the restoration of work of enterprises in the basic sectors of the economy.
But there's a rip current under this wave of reopenings. In Seoul, nightclubs have new posters banning gatherings, and bars that were open on Friday night now have padlocks. A single 29-year-old visited this neighborhood last week to go clubbing and infected more than 50 people. The only reason the clubgoer had been allowed out, South Korea relaxed social distancing 10 days ago.
It will be a long time before the COVID-19 outbreak ends completely. We should also brace for the pandemic's second wave, which many experts are predicting.
This is a virus that has a foothold in human populations and is not going anywhere.
Dr. Rebecca Katz directs Georgetown's Center for Global Health Science and Security.
I'm not even sure that we've finished the first wave, and already individuals and decision makers are trying to move on as if we're over the hump or we're past this problem. But in fact, the curves are telling us we're still in the midst of it.
For months, Singapore used widespread testing and meticulous contact tracing to prevent an outbreak. But positive cases have jumped 100-fold because authorities admit they failed to consider these tower blocks. They're full of foreign workers who can't social distance. The spike among those foreign workers exposes the danger of overlooking vulnerable populations.
Often you're putting people in situations that are kind of perfect for disease transmission. And then that transmission passes over to the rest of the population.
In northeast China, state TV showed police setting up new checkpoints after warning of a new wave and reclassifying a province as high risk. In Wuhan, where COVID-19 began to spread, authorities reported a handful of cases, the first in more than a month.
We're taking the first careful steps to modify our measures.
In London yesterday, Prime Minister Boris Johnson unveiled the United Kingdom's first plan to get workers back on the job.
Anyone who can't work from home, for instance, those in construction or manufacturing, should be actively encouraged to go to work.
But this morning, commuters and the opposition party called the guidance confusing. And Scotland's First Minister Nicola Sturgeon rejected the plan out of fear of a second wave.
My judgment right now is that the risk is still too great. Too many people are still dying.
Countries should lift lockdowns only when they can identify new outbreaks. World Health Organization's Emergencies Director Mike Ryan said today.
If disease persists in countries at a low level without the capacity to investigate clusters, identify clusters, then there is always the risk that the disease will take off again.
It's going to require a lot of testing, tracing, isolation, quarantine, treatment when we possibly can, good, strong case management. This is resource intensive. It requires a really robust public health system, which, to be honest, doesn't really exist in most parts of the world.
Which is why experts say this isn't the second wave, it's the second inning. And there's a long, treacherous path home. For the PBS NewsHour, I'm Nick Schifrin.